Hello and welcome to this tutorial on iron deficiency anemia, which is the most common form of anemia because it affects many groups across the lifespan. Basically, we have decreased iron equals decreased red blood cells because we need it to make healthy red blood cells equals decreased oxygen, and as a result, sad tissues. So we have symptoms that result from that. Including pale skin. Whites of the eyes can appear blue in color, and also our tongues can become smooth or sore or swollen. Confusion, irritability, behavior changes in general. Children can start getting bad grades. Fissures at the corners of the mouths or cracks. Cardiac symptoms include chest pain and shortness of breath. We're at increased risk for infection system-wide. Could be bladder infection, could be flu or otherwise. Spleens can become enlarged and may be palpable. We get cold intolerance in hands and feet, and also some restless leg syndrome. And some people might have pica or crave non-food items. Others in this case might crave celery or want to chew on ice. Of course, people can generally feel fatigued, and an easy thing to check for are fingernails, which can, of course, besides appearing pale, can be spoon-shaped or brittle. Diagnosis is usually by just a simple blood test, which evaluates these various components of the blood. And the first one is going to be a CBC to show us something is wrong in general. Hemoglobin hematocrit and MCV. Hemoglobin hematocrit are different in males and females. In males, if there's an issue, hemoglobin less than 13.5, hematocrit less than 41. Females, hemoglobin less than 12, hematocrit less than 36. And in both groups, MCV, which is simply the size of the red blood cells, less than 80, showing that they're smaller. Transferrin is going to be elevated at greater than 240. That's the transport molecule for for iron. And platelets can be up at greater than 450. Serum ferritin less than 13. Although if chronic, some sort of chronic condition is contributing, this actually might be normal, such as hepatitis or some other condition that the body has also already stabilized the ferritin, which is the storage molecule for iron. Serum iron is going to be less than 60, and iron saturation is different between males and females. Males, iron saturation is going to be less than 15 in males and less than 12 in females. Really can't figure out what's going on. We can look right at the bone marrow where all the action is happening and the iron is being put into baby red blood cells. So then we talk about why this is happening briefly. Decreased absorption, decreased intake, increased needs, or loss of blood. Decreased absorption is going to result from some sort of gastric issue, so gastric bypass patients, Crohn's and celiac sufferers, and really anybody with a history of GI issues, GI surgery, GI cancer, because iron is absorbed in the GI tract. Intake, consider the population, so elderly people might just not be getting enough food, enough iron-rich food specifically. Strict vegetarians, and people without enough money. strict vegetarians because meat is a primary source of iron. Increased needs is one of the reasons that pregnant moms and breastfeeding moms are affected, as well as children, because they are growing. Here's a hat. And blood loss can occur from anywhere in the body, but some types that people might slowly be bleeding from their GI tract, which is why we do tests such as stool for alcohol blood or colonoscopies to find the cause, and women with heavy menstrual periods, heavy menstrual bleeding. In regards to preventing iron deficiency anemia in the first place, we want to make sure groups that are at risk are on supplementation or getting enough in their diet. So 8 to 18 milligrams per day is the recommended requirements based on where you are in the lifespan. Foods that contain iron include peanut butter, oatmeal, liver, and beef, meat products, poultry, chicken, turkey, even some fish, raisins, whole grain breads, soybeans, apricots, prunes. Iron absorption can be increased with vitamin C, so oranges or any acidic food actually increases the absorption of iron. Certain foods inhibit the absorption of iron, so calcium-containing foods, calcium-containing medications should be avoided with the iron supplementation. So milk, and also caffeine inhibits absorption, so coffees and teas. Fiber can inhibit absorption, so certain cereals, and any carbonated beverage can also inhibit iron absorption. So that is a brief overview of the what is of iron deficiency anemia. I hope you enjoyed it. Thank you.